Hello again. COVID-19 cases appear to be declining. Just over 1,600 cases have been reported in the last 24 hours. Now, the National Institute for Communicable Diseases, that's the NICD, says the country could be entering a new phase. It says current patterns demonstrate that a surge in transmissions is unlikely to overwhelm the health system, but that new ways are needed now to monitor the risks. Well, let's discuss this now with Progressive Health Forum's Dr. Aslam Dasoo. Dr. Dasoo, good afternoon. Thank you very much for your time. Welcome to today here on eNCA. Numbers coming down, that's a good sign. I know most times you doctors and scientists will say we have to look for a trend, but at this stage it looks like things are stabilizing and we're getting into a better territory. Or am I getting too excited too quickly?
So let me play true to form. Good afternoon to you, Dan, and urge a little bit of caution, although the signs are encouraging that we are likely to avoid the kind of surges we saw in the previous waves at this time. Now, you know, it's not inexplicable. We can predict why this type of thing happened. In fact, when the Omicron variant first reared its head, we already saw a decoupling between the number of cases and the amount of death associated with those cases when compared to previous waves. So this new variant, you know, portended a potential shift in the evolution of the pandemic. Now, what we have discovered is that this current resurgence we have seen, it did top 10,000 cases a day at one point, which of course gave us pause for thought and, you know, considering whether we might be entering a fully fledged new wave, even without a new variant. And that was because there were subvariants of the same Omicron virus that was, you know, that were making their rounds, the BA4 and the BA5. Now, that alone, I think, may help explain why we are not seeing the kind of numbers that we expected, because there has been widespread immunity already to the Omicron variant because of widespread infection and slowly but surely increasing rates of vaccination. And so a subvariant in that situation is less likely to be as virulent as a whole new variant, which comes with a whole lot of more mutations. And that may well explain why we are not seeing this explosive surge.
So in the short term, I don't want to risk and say in the long term, because we don't know what's going to even happen tomorrow, but in the short term, surely the outlook is positive.
Yes, I would say that would be a fair assessment. But it's important that we keep the context that the pandemic evolves. And so we are now just entering a new phase of the pandemic, and we may be entering even the early phases of endemicity. That we, of course, can't say with any certainty. We would need quite a few more markers of a trend for that. But we did suggest already early this year that 2022 will be the year we pivot out of the emergency phase of the pandemic. So yes, we have to potentially look at a new way of approaching the pandemic.
I was just going to come to that point. If we're about to pivot in terms of where the pandemic is, locally and globally, as you say, following those early predictions, surely we also need to pivot the restrictions and the regulations around how we manage the risks.
Certainly. I think that just makes perfect sense, and it's a very reasonable approach. Look, we've kind of been behind the curve as far as restrictions are concerned when compared to where the pandemic phase is. And this has been not only in South Africa, I think in many countries, you know, an overabundance of caution, etc. What we do know is that the restrictions that are currently in place have minimal, if any, effect on the transmission. So I think that the authorities can, with greater confidence, you know, attenuate those measures, especially in the light of the new developments. I would say it would be premature to call off any idea that we are entering a fifth wave. That may still come, though the likelihood is low. And I think until we know that, there's not likely to be much movement on the restrictions. Although as soon as we know that, I think then that it becomes incumbent to do away with the remaining restrictions that affect economic life and that have no effect on the transmission of the pandemic.
Yeah, currently the government has extended the period for comment on the new health regulations to early July after extending it last month. And people maybe might still be commenting. But was the overwhelming view that you are picking up as a scientist, as a doctor, from your peers around the way forward? Because government says it has to listen to scientists before it decides exactly how or what or which regulations will be in place. And there's lots of opposition and criticism, for example, against some of those regulations.
Sure. And it would be better, I think, if the government listened completely to what the scientists have said already and are currently saying. The scientific consensus here and globally is that we are really in no need of any of these restrictions any further. We are all pandemic veterans ourselves. We know what to do. We know that even when there is an increase in transmission, we know how to take care of ourselves. And I think that is important. We also know that there's no overwhelming of our health services with the current wave of infections. That may change if a new variant emerges. But again, we must then act at that moment in the requisite fashion. For now, clearly there's the scientific consensus is fairly clear. We can do away with with most, if not all, of the current restrictions in place. I think the government's approach to putting in these regulations is also with a view to enabling the National Health Act, which fortunately now will govern this as a public health matter, to be enacted should the need arise. However, we must be clear that what they regulate can't be set in stone. It should simply enable the National Health Act to allow the minister to, promulgate urgent regulations should the need arise and not put those regulations in permanent setting in the law. And I think that is a very important message to the government, which is going through its legislative process on this.
Thank you very much for your time this afternoon, Dr. Aslam Dasoo.